So I hope you all had a really good time last night at Dynamic Earth. Perhaps too good a time because there's a lot of people who are not here this morning just bright and early, but we will. As Wendy was saying, yesterday we went quite wide and quite deep in the ideas around planetary health. And we also went intergenerationally. We went from time back to time forward. We're thinking of the future. We had the elders speaking, we had the children speaking. And we thought about how each of us, we have a child in us, and we honor children, and we know children, and we know the children who are going to be growing up into the future. But what I want to say as well is that Scotland has really pushed us to encourage Scotland is now. There's no time to think, okay, we'll get ready and somehow we'll make things better in the future for those who are in the future. We're saying we need to make things better now. We need to take action now, because we need to honor everyone who is living now and everyone who has visions and aspirations in the here and now. And I think that's very much about how today, this very first session, is going to be, because what we're going to think about in this first session is how across Scotland we have looked at the different ways in which we are communicating the power of planetary health. The other thing that happened yesterday was as we talked about communication, the message that came out was there's no point in communicating just among the converted. There's no point if the only people who think about planetary health are the scientists and the academics and the practitioners who actually believe in planetary health, and we believe, we are concerned about health. What about people who are not part of this conversation, but actually living in this conversation and believe, knowing that they need to know more about how to do things? And that's why this morning in our panel we have got a group of diverse people who represent different parts of our Scottish community and who together are making a better Scotland. So I'm going to introduce the panellists, and then I'm going to ask Andrew and Roger as the first ones. But Andrew is, you have to go to his website. You must go to Andrew's website because Andrew does 1,001 things. Andrew Murray. Scotland has two Andy Murrays. And this is the Andy Murray, the runner. Andrew ran from the north of Scotland to the Sahara one year, one winter. When was it? It was in the A few years ago. A few years back. Just running from John O'Groats across to the Sahara. Extraordinary run. Andrew's also run 7 marathons in 7 continents in 7 days. An amazing runner. But actually, Andrew's passionate about physical activity, passionate about thinking, how do we get people to be more active? And alongside Andrew is Roger. And Roger is the lead for the Golf and Health Project for the World Golf Foundation. And we're going to hear about why golf and health matters. Now, the astute among you are probably thinking, or may not be, but you might be thinking, What's that vase? They're going to go, what's that claret jug doing in the McEwen Hall? I'm not going to tell you about the claret jug if you don't know they are. But this is, I'm not sure what the equivalent is in other sports. It would be like having the Wimbledon plate here. It's quite important, it's quite significant, the claret jug, and it's here for a reason. And then we have Mel Young, and Mel is the president of the Homeless World Cup. And Mel, again, if you look at Mel's site, if you look at what's happening in Scotland and how Mel has led the Homeless World Cup, working in now 70 nations with teams of of young people who were homeless and who are beginning to really build a different life, but using using the mechanism of sport, of football. And Mel is going to describe a little bit about that. He's the chair of Sport Scotland. And then Sharon is coming from our NHS and is going to talk to us about why it's important to within the NHS to think not just how therapeutic our drugs are, but what's the carbon footprint of our drugs. How do we think differently? How do we think about green prescribing? How do we actually think that we use the assets of Scotland? And finally, Katrina is from the Edinburgh Festivals, the Environment Officer from Edinburgh Festivals. And you know Edinburgh as a festival city. That's what we do best. And Katrina is going to talk about that. So that's the shape of this morning's session. It's a short session, but it'll give you this taster. And then after that, we have one more session looking at faith and culture and the arts. And after that, there will be a chance to, if anybody wants a photograph taken with the claret jug, because if you know a golfer, then you want to have your photograph taken with a claret jug. So I'll hand over to Andy now. Thank you.
Thank you very much.
So thanks, Liz, for that much too kind introduction. What she didn't mention is that when I did run to the Sahara Desert, I also got overtaken by a donkey twice and broke my nose running into a road sign. But running to the Sahara Desert actually taught me that regular physical activity is one of the best things that you can do for your health. Sitting at night, I had about 5 or 6 hours each day to run, about 34 miles. But I also had a lot of time to think and to read about the issues that matter in terms of to health, to my own health, but also to the health of my family and to my friends and to the planet as well. And it made me also quite embarrassed that as a general practitioner, I wasn't actually doing the right things for our patients every time. Too many times I was just thinking of a medication or thinking of a procedure that we should be offering our patients and not thinking about some of the important things we can do in terms of advising about what we eat, advising about regular physical activity. But who wants the bad news? No one wants bad news. Maybe a few. But if you're regularly physically active, if you go from being a couch potato to exercising regularly, you will be about 50% more likely to get blisters. But we're in Scotland. Everyone loves a bargain in Scotland. And you get 30% off an early death. You're 30% less likely to die early if you're physically active. And there are so many other benefits that you can see as well. So between 20 and 70%, 40 major important chronic conditions, type 2 diabetes, heart attacks, strokes, some types of cancer, and it's also extremely important for the brain, decreasing the risk of dementia, depression, and anxiety, and also, I think just as important, giving you green space, time with family, social connections, and all that thing as well. So regular physical activity is genuinely one of the best things we can do for our health. So it was fantastic to see the offer in terms of dancing, in terms of yoga, runs, walks, all part of this Planetary Health Conference. So congratulations to Liz and to the conference for putting that all on. Who here's got children? Mine kept me up last night, but I still love them. And regular physical activity is one of the best things that we can do for our children. It helps get them better marks at school. It helps build those social connections and get them outside. It can also help make them be happier and healthier overall. So who wouldn't want that for our children? Is that better than some of the other presents we give them? But it also very much fits in with the Planetary Health Agenda and the UN Sustainable Development Goals. Just last week at the World Health Assembly, the Global Action Plan on Physical Activity was launched, and what it calls and what it is clear on is that everyone has a contribution to make. Everyone in this room can help improve physical activity worldwide, which will contribute to planetary health and will contribute to the UN Sustainable Development Goals. Do we think that's possible? It is. And here's how. Here's what makes clear. Everyone has got a contribution to make, whether your field is communications, whether it's in education, whether it's in urban design and in transport, whether it's in sport, like Roger and ourselves, whether it's also working in communities to try and build programs that can build capacity and increase physical activity and build a range of other benefits as well. So the argument, according to Dr. Tedros, the WHO Director General, is compelling, and the aim is clear: to get more people more active more often, not only for the health benefits that brings the individuals and the individuals' communities and the population, but also for the wider collateral benefits it can have. And working for that plan, but also working as an advisor for the Scottish Government, it was really good to see local action on this. So Scotland has recently committed to a doubling of active transport budgets recurring for the next number of years. And the reason that's so important is not only for the health benefits that will bring our nation, but also for the sustainability considerations. In addition to that, they're looking to prioritise walking and cycling, doubling the budget, but also prioritising low emission zones and making sure that, certain types of vehicles are being phased out. Also offering 20-mile-an-hour limits. If you go outside, you'll see a lot of 20-mile-an-hour signs, which might slow you down a little bit, but it also means that far more people are being more active more often. The other initiative is something called the Daily Mile. Has anyone heard of that? Perfect. Not that many folk have heard. I can spread the word on it. So every child in Scotland is going to be offered the opportunity to walk a mile, to run a mile, or to be active for a mile each day at school, which is again good in terms of raising attainment, but also increasing physical activity. So this is my dad, this is my daughter. You can see that sport and physical activity can, build social connections, and Scotland is the home of golf. Roger will speak a bit about golf and its history and the opportunities that links in with the UN's SDGs and also with the Global Action Plan on physical activity, but it's fun. I'd urge you, while you're in Scotland, get out, go for a walk, see the amazing sights that we have in Edinburgh, go up Arthur's Seat or go to the castle. But if you can, also have a go at golf if you can, because it was invented here. I'll hand over to Roger.
Thanks. Thank you, Andrew. Thank you. I'm fighting the deadly red light here to say that we've over our time, but I'm Roger Hawkes. I'm the Executive Director of the Golf and Health Project. I'm also a board member of the European Disabled Golf Association, aiming to get golf into the Paralympics and to make golf more inclusive. And I was Andrew's predecessor as the Chief Medical Officer of the European Tour. The aim of the project was to publish the evidence for the benefits, explore and publish the evidence for the benefits and disbenefits of golf, identify gaps in knowledge, and communicate the results. This came at a time when golf was in the Olympics, and there were some bad news stories about golf, and golf was in decline. It would be bad of me not to mention that we are in the home of golf in Scotland. I know the Dutch may disagree with that, but here they are playing golf in the 1700s, which is how long it's been around. And of course, golf is also in the Olympics, which has given it much bigger traction in the world. The results of the scoping review have been interesting. Andrew Murray, as our PhD, has been the main author, but has discovered that 55 million people play golf around the world. 80% of golf countries have golf clubs, and 1 in 127. It's quite a lot of people playing golf. And it was published in the British Journal of Sports Medicine, which is the leading international journal on sport and exercise science. So we're sort of proud of that. Our leaders before this had great difficulty talking about golf and health. Everyone feels great after a round of golf, but they weren't able to stand up and say, golf's good, because they were worried about being shot down. They've now got good evidence for that, which they're able to quote from. And the other conclusions is that golf is a moderate, intense physical activity. That's really important for policymakers. Golf is associated with 5 years of extra life, regardless of gender and income. That's also very important. And of course, that's not a big news story for us that understand exercise and health, but important in the context of our sport. So golf is overall good for heart, lungs, etc., and it's likely to be good for mental health and wellness, but there's not enough evidence on that already. So there are some gaps which we've discovered. We weren't the first people to do this, because Dr. Benjamin Rush in the 1800s actually realized that golf was good for you and had already mentioned it. I've only just discovered this. So what are those gaps? Well, it's the quality of life. I think policymakers, the idea of people living longer to policymakers is not actually great news. But if we can say that the quality of life's improved, they'll be much happier. And at present, we're looking at strength and balance and some pilot work to suggest that people develop strength and balance by playing golf, which may lead to a reduction in falls. And of course, that's a reduction in cost. And we're exploring that at the present time in California and in Southampton. And social interaction. We're only just getting our heads around this. You know, I didn't realize. There's some studies now which suggest over a 6-year period that the biggest risk factor for death in that time is lack of social interaction. Forget about smoking. No, not forget about smoking, but you know what I mean. And the green space. There's some wonderful green space and increasing evidence that exercising in green space is much more beneficial than it is working in a gym. We've got a London Declaration coming up in October, where we've got the Public Health Minister of the UK, ISPAR members, because it's at the ISPAR conference, which is happening at that time. And we're going to be welcoming the an international consensus on golf and health. And at the same time, we're also going to sign up to the principles of the Global Action Plan on Physical Activity. Here's Gary Player, one of our ambassadors, who is the epitome of fitness, someone in his 80s. And we haven't just, we're not just talking about older people. There's some work going on. Erasmus funded a project here looking at how we can introduce golf into countries where golf is not traditional, and some very good experimental work which has just been published, and I suggest you see that. So where do I see the future of golf? Well, a better perception, because I know some of you are thinking, golf, that's middle-class people, you know, eating too much, drinking too much. We need a better perception. We've got to demonstrate our inclusion, and it's not just me that's now a board member of the European Disabled Golf Association, but Keith Pelly, the chief executive of the European Tour, has now come on board as well. We need multi-use golf courses. You need to turn up in the morning, some go and play golf, some go and walk around with the dog, and you meet up for lunch. We need to work on, to add to the social interaction benefits there are with our sport. And more therapeutic use, because I'm going around looking at projects at the moment, looking at golf with older people with a strength and balance study, but also very relevant to people with Parkinson's and dementia. And some very good results I think we're finding as well. So we're not that we're interested in people playing golf, but we're aware that not everyone will. But what we want to see is more people, more active, however they choose it. And if you want to hear any more about some of the projects I've said in this talk, please go to the website and have a look. Thank you, Liz.
Thank you. Thank you very much. We'll move on with the talks, and then we'll hopefully have a little bit of time for questions. So can I invite Mel up now, please? Thank you. And thank you so much for that, Andrew and Roger.
Morning, everybody. Thank you very much, Liz, for inviting me along today. It's good to be here. I'm going to tell 2 stories in the next 10 minutes or so. First one really is about Sport Scotland and sport in Scotland. We're very proud that we want to be a world-leading nation here in Scotland in terms of putting sport as part of the overall health context of Scotland. We want to be world-leading. We are world-leading in terms of what we're trying to achieve. We have a strategic approach. And this slide that you see in front of you is one we use all the time because it encapsulates a system that we have. And we want this system to be world-leading because it involves everybody. Sport sometimes is seen as simply about elites, those wonderful people who break world records and win World Cups and so on. That is just part of sport. Sport is much wider than that and involves everybody in the community. Everybody can be involved in sport in some capacity, and that's what our drive is, to build a system in Scotland through people, places, and profile to encourage people to get involved in sport. And it really follows on what the previous speakers were talking about in terms of getting people active so that the well-being or the overall well-being of Scottish society is enhanced. We, sport, play a part in an overall system approach which the Scottish Government is applying to get people active. And in the Western world, as all of you will know at the moment, one of the biggest challenges for all countries is inactivity and the potential problems that's going to cause health budgets in the future. So we want to, in Scotland, we want it to be a wealthier, fairer society, smarter, healthier, safer, stronger, greener. Those are the major government initiatives, and sport can play a very, very important role in achieving that. And that's very, very important aspect of what we do in Scotland that I think possibly differs us from other countries in that we see sport as playing a critical role in that overall development. It's not just sport for sport's sake. I'm going to show you some statistics now from some research that we've done recently. Now, sport is sometimes very good at talking to itself about what it's doing and not very good at talking outside. So we've done this research to illustrate what we know is actually going on. So we have one of the strands of our system for Sport Scotland is our active schools. And the outcomes of the research, which was a substantial research, across 3,000 sports clubs and 15,000 school pupils, was really quite startling. If you look at these figures here, what you're talking about is huge numbers of change that's taking place. So it's not just about being active in the sense of being active running around the place. It's actually other statistics like making friends, feeling better in yourself, this overall well-being. So it's about mental health as well as physical health. These statistics are very, very encouraging and prove absolutely the power of sport in creating something that's very constructive. We also have community sports hubs in Scotland that we've developed as another part of our strategy, which is selecting areas, might be schools or football clubs or whatever, where other sports clubs can come together and be a hub. And these have been developed, and it's been part of the Commonwealth Games legacy, and we've grown them and been very ambitious. And they've been very successful as well in pulling people in the community together. And once again, in this research that we've done, which is quite substantial, you can see, I'm not going to read the statistics for you, we can see substantial high percentage of people getting involved in community sports and receiving huge benefit from as a result of that. So we want to be world leading, we want to be world class in terms of, we want to win lots of medals. We had a very successful Commonwealth Games. We wanted to win the most medals ever in a away game for Scottish team, which previously was 29 and we won 44. It's superb. And that inspires people and that connects into our system. And then we have places where then people can be, after they've been inspired, can come and join in and play golf or get involved in golf. As the previous speakers have been saying, any sport, there's an entry to it. So that's what we have here in Scotland. We're very proud of it, and we will be building on it, continuing to build on it, make it more effective, build quality into it, and do more across the whole country. That's the first story. The second story is something else that I do, which is called the Homeless World Cup. Homeless World Cup was started in Scotland. We invented it. It's a Scottish invention. It started in 2003. And very simply, all that happens is that we take a football into the street where homeless people are and get them involved in playing football. And the beauty of the ball is it's really, really simple. Anybody can play football. You just can kick it around. And you can do it anywhere. So we could actually have a game in here right now. If you wanted one ball, split the hole in two. It would be a bit chaotic, but I promise you it will be good fun. And that's a critical thing about sport. So the beauty of the football and homeless guys, we can go take the ball into the street with you and say, do you want to play football? And they will generally do. And we encourage them to come back. Throughout the year, we work in 72 countries now. We work with at least 100,000 homeless people across the world each year. Once a year, we have a tournament, and the slides up there are from Glasgow a couple of years ago. The event is really the culmination of the effort that's been taking place around the world. Now, when we started this in 2000, so every year we have this. This year it's going to be in Mexico City. Last time we were in Mexico City a few years ago, there were 168,000 people turned up to watch homeless people play football. Now, the critical thing for us is about the impact. So when we did the statistics about what was happening with the guys that were playing football, we found huge percentages of them were getting off drugs, getting off the streets, getting jobs, getting houses, and the statistics were so good we actually didn't believe them. So we had to get them tested about 3 times more to check out that this was really happening, and indeed we found that it was. Now, critically in this is a statistic that's not there that I want to share with you, because these days people, I believe, are kind of go data mad. Everything is about data, and I'm showing you some statistics and so on. Unless you have the statistics, you can't prove anything. But we got some researchers to have a look at the social capital value of what we were doing. And for 2016, they came up with a figure of $364 million. So the value of what we were doing in just one event in 1 week was actually a contribution to society of $364 million. Now, that's worked out by, people tend to think that homeless people or homelessness or poverty costs nothing. Actually, it's pretty expensive. Some studies in New York said a homeless person lying in the street just lying in the street, just being there, not doing anything else, will cost society $30,000 a year at a minimum. That's the amount of time the police stop and speak to them 4 times a day, and the amount of time they get put in prison for a day because they've got no fixed address, etc., etc. That chaos was costing that amount of money. Other countries will tell you that statistic's much higher. Ergo, when you have a look at the social capital input, that $364 million that I'm describing to you, you start to see that actually investing in this type of activities for governments starts to become really valuable. They start to understand that small amounts of investments will actually save them huge amounts of money. And that's the key thing in this whole issue about our health and well-being, I believe. It's about having a look at different measures potentially, having a look at different impacts so that we can all improve. So maybe rather than measuring GDP all the time and being obsessed by it, we might actually start to measure social capital value of initiatives that make the well-being and the health of our nation actually improve. So the Homeless World Cup, since we've started, we've worked with 1.2 million people across 72 countries. Many of those guys, as I say, changed their lives forever. Some of them now come back and are actually leading our partner projects. We work with one partner per country. Former homeless people now becoming coaches, becoming referees, and actually critically taking on leadership roles out there in the street and bringing other homeless people into the activity. So sport, I hope I'm demonstrating, is an incredibly powerful tool for the betterment of the health of any nation, better for any improvement of the world. And it's great that you've allowed sport to come onto this agenda at this conference. We have a role to play, but crucially, as I said when I was describing what Sport Scotland does, sport is only part of it. Everybody has to be working together. So it has to be working with the transport, with health, with education, together with a connected strategy which will improve our activity, our ability to tackle what I would describe, if I want to look at homeless, the most intractable problem in the world. People throw their hands up in horror and say we don't know how to deal with homeless. 3 million people on the streets in the US apparently. People just don't know how to do it. We've actually demonstrated it's actually a very simple way of doing things by getting people involved in sport and then creating pathways out of it. And that's the power of what we do. Connected together, that's how you can change the world for the better. for the betterment of our health, for the better of our well-being. Sport's got a very important role to play. And here in Scotland, we're onto it. Homeless World Cup is based here. Sport Scotland's onto it, making it better for people who are living in this country. It's very positive. Very happy to be here. Thank you very much.
Thank you, Mel. And you know, what we're hearing is what we talked about yesterday. How do we communicate with those who are not hearing the message? How do we encourage a movement of lots of people to begin to connect together so that they are valuing themselves and then valuing the other and valuing the space that we're in and caring about the environment, caring about what is happening. And I think what this first part of this session has done is saying there are communities there, communities who will never be sitting inside necessarily McEwan Hall talking about planetary health because they're not in this space, and yet they are key to the message of planetary health because everyone is involved in this. And if we really believe in our ambitions around planetary health, then everyone is, and therefore we need to think of ways. So thank you so much for showing us how sport can change things. Now, can I call Sharon to come, and Sharon's is going to say a little bit more about another Scottish mechanism for bringing change. Thank you, Sharon.
Thank you very much, Liz. And good morning, everyone, and thank you for getting up so early to come to this first session and listen to us. So today I'm going to talk to you about pharmaceuticals and the impact on the environment. And this is something I think that affects every single one of us, because I reckon that every single one of you will have taken at least one tablet in the last year. And I thought to myself yesterday and with a few colleagues, how on earth can I follow on from these three gentlemen talking about golf balls and footballs? Some of you, I've given you the secret last night, some of you know what I'm going to say, but I'm going to try and keep you awake today with the promise of talk about sex and balls and give you a giggle and some audience participation. So the common theme here is balls. And when I'm talking about balls, I'm talking testicles. More later. So I'm here representing the Green Breakthrough Partnership, which is a partnership that we formed over the last year with many public bodies, the NHS, our Environment Agency, our Scottish Water Agency, and various universities and health research institutes. What we have done is form new partnerships that we would never have thought about thinking about before. We're transcending traditional boundaries. The NHS wouldn't speak to the water company, and the water company wouldn't speak to us. Why would we? But we found actually that we have got something in common, and that something in common is that we want to save the planet. So we are showing leadership commitment. In Highland, in the NHS, we have what we call the Healthcare Quality Initiative, and we know that by actually putting quality first, you can deliver better health, better care, and better value. And by forming these partnerships, we talked a lot yesterday about getting the right people around the table. So by having all different types of expertise, we think that we can actually deliver a better environment at the end of this. Before I move on, I've got to give a couple of shout-outs. Got to do this before I forget. But we had a round-table conference in Inverness last year, and it wouldn't have happened without healthcare, without harm. Anya Leitz sitting at the front here, and without the Highlands and Islands Enterprise and Diane Duncan. And I've also luckily got John from SEPA here today as well. So all of our partners really engaged in this agenda. So where are we in the Highlands of Scotland? We are the blue area, area number 5 there. Scotland has a population of about 5.5 million. In the Highlands, we have about 300,000, but we cover an area that is bigger than Belgium. It takes 7 hours to drive from the top to the bottom of our region. So real difficulties, challenges in developing and providing healthcare for a really remote population. Yesterday, you had the principal of the university and the Lord Provost tell you to come and see Edinburgh. I'm going to tell you, go higher, come to the Highlands. This is what you see in the Highlands. It's not the Caribbean, it's the Highlands. We get this almost every day, don't we? Yeah? Sometimes we get moody, sometimes it's like this, but it's also beautiful and cultural. We have lots of whiskey around, lots of golf courses, and lots of castles. So please do come higher. We're also famous for our flora, our fauna, and our aquatic life. Most of it actually ends up on our plates. You'll have had some last night. And hopefully the Kaylee will go a bit better tonight because you'll have some of that amber nectar up in the right-hand corner there if you haven't already sampled some. So let's get on to medicines and why do they matter? In the NHS, excuse me, the prescription of a medicine is the most common thing that happens to you as a patient. In Scotland, we're almost spending £2 billion on medicines and 20 billion across the UK. So a lot of resource being used there. Sam Myers told us yesterday, he showed us his planetary health schematic, and he said there were 3 drivers: demography, technology, and consumption. And that's the same for medicines. We've got a growing population, many more older people. As you get older, you tend to get sicker, you take more medicines, something we call polypharmacy. We've had technological advances over the last couple of decades. We can now cure hepatitis C. We live with cancer, and HIV is no longer the death threat that it used to be when I was young. We also have a pill for every ill culture, and I'll talk more about that. But we know also that waste is increasing. And the World Health Organization in 2003 told us that probably 50% of people don't take their medicines properly or don't take them at all after they're prescribed. So lots of waste there. So let's think about that pill for every ill culture and think about what the gentlemen were saying about exercise earlier. In the NHS, we are trying to change the public's role, give the public more power, the patient more power, to give them a shared decision-making approach. So it's not just the clinician, the prescriber, telling them what they have to do. But with that comes increased demand, and sometimes inappropriate demands for healthcare. And we know that as a country gets richer, you spend more on electric, on water, on copper, on concrete, and that's exactly the same for medicine. But we now are in a situation, and we heard yesterday where Hannah showed us graphs of diabetes, cancer, etc., that we are relying on medicines to fix things that we're causing ourselves by making poor lifestyle choices. We're over-consuming things that aren't very good for us. So people are turning to that pill for every ill. Now, did I tell you there was going to be audience participation as well as talk of sex this morning? Well, how many people think that when you take a medicine, X percentage comes out in your urine? So hands up for nothing. Hands up for 5%? 10%? Sorry? Yes. Yeah. 30%? 90%? You've all done extremely well this morning. Well done. So we know that if you actually take a medicine, between 30 to 90% of that dose that you take actually is excreted in your urine, and it ultimately ends up down the toilet in your wastewater system. And that's the main way that a medicine will get into the environment. And another way is by improper disposal. People still think that the safest way to dispose of a medicine to keep it out of reach of children is to flush it down the toilet. I started life as a pharmacist working in the community before I went into public health, and this slide is pretty representative of what I used to get brought back to me when a patient died, when their relative brought their medicines back. Staggering. And this represents some of the 50% or even less adherence to medicine. So people just keep on ordering them, but don't take them. So we've got that waste. And at least those people brought the medicine back to me to dispose of safely and didn't flush it down the toilet. So what evidence have we for pharmaceuticals in the water? Up till now, it's been antimicrobial resistance. We know that by 2050, there are going to be 10 million deaths a year because of AMR. It's going to be the leading cause of death. And bringing in the sex again, we know that so far for aquatic life, it's led to intersex fish. So we have male fish who in their testes actually carry eggs. And that's not too good for reproduction, so it leads to a loss of population. So far, we don't know much evidence about humans, about the effects that it's going to have on our health, but actually we're just taking a pragmatic approach here and trying to work, as Liz said, we need to work now before we get the evidence. So we know worldwide that there have been about 600 medicines actually found in our water system. And as you can see, it affects every part of the world. So why are we interested in Scotland whenever we've got that clear blue water that I showed you? Well, if you look at the difference in a couple of samples in our population here between the Orkney Islands, which is a really remote island right at the north, sparse population, agriculture, food and drink as its main incomes, And then we think about the river that's running through Edinburgh. We've sampled lochs, rivers, and our seawater, and we're still finding many medicines there. So this is an issue globally, and it's also an issue for us in Scotland. So what does it mean for our water, for our human health? It can compromise the quality of our water. It makes things a lot more difficult for our water companies. Our wastewater systems were designed over 100 years ago, before any of these medicines were ever even thought about. They are all, though, designed to have a biological effect. So one could assume that that biological effect will continue once it gets into water, and it will create what I think I call a chemical soup. So some of the questions for me that still lie unanswered are, will daily exposure that we get in our water to subtherapeutic, very tiny doses over a period of time actually end up having an issue for our health? And how will all these different chemicals in that soup interact? Will they start to do things as a combination that they don't do on their own as single medicines? And what about the metabolites? So what are we doing in Highland? So far we're working with universities to look at AMR, also to look at the biodegradation of molecules to see how they break down and how they act once they have broken down. We've got an antimicrobial team making sure that we make the best use of antimicrobials in our population and we don't overuse them. We're working with the public and our clinicians, thinking about the key messages that they've got to understand about pharma in the water. And the most important thing that we're doing is work on our joint formulary for prescribing notes for our clinicians. A formulary, if you're not familiar with it, is a list of medicines that prescribers can choose from. Normally, we make our decisions based on clinical effectiveness and cost effectiveness, but we've been working with our partners in Sweden from Stockholm City Council to think about the hazard that some medicines cause and to actually bring a third tier of decision-making in alongside clinical and cost effectiveness to think about the environmental impact and the hazards that are caused. And this is a list of 25 medicines that our colleagues in Sweden are working on. And we're just about to start work on this in Highland, and we want to take it further and expand this list. So what they've done in Sweden is they have invented a Pbt Index, and that Pbt stands for persistence, bioaccumulation, and toxicity of the drugs. And each of those categories can score up to 3, and then you add them all together and you get a top score of 9. So we're looking there at a sex hormone to continue the theme. Ethinyl estradiol, one of the riskiest drugs that we have. We use it a lot, whether it's in HRT, whether it's in contraceptive pill. So it's pervasive throughout our society. And you can see it scores 9 there. So what we hope our formula will do is have a list showing our clinicians the risk and what they can do to mitigate that risk. But we also, getting back on the exercise theme, we want to make sure that people make healthy choices and that healthy choices are actually the easy choices. So looking there at the Prince of Wales, 150 years ago, he says, if it's preventable, then why isn't it prevented? And we're still pondering that today. So we think that if we try and shift the balance of health towards moving away from illness to prevention, we empower people to get out there and take responsibility for their own health, just to do what the gents have said here, golf, football, sport, anything, and to make the easy choice, the healthy choice for people. So just something for us all to ponder there for a minute. So, in summary, the key facets of our work, I believe, we are working together in a new way in Highland and in Scotland. We're working upstream to prevent as much pollution getting into the environment. We're taking responsibility for healthcare, because healthcare is a polluter, and we're raising awareness amongst the public and clinicians. And I just want to leave you with a final question. I'm sure you're all familiar with Blue Planet, David Attenborough. He has done what no one else has done for the discussion on plastic in our oceans over the last year. And I'd love to discuss with you over coffee or lunch, how can we get that Blue Planet effect for pharma to give us a green planet? Thank you very much indeed.
Thank you so much, Sharon. That was excellent. And finally, I'm going to call Katrina up, and Katrina's going to talk to us about the work she's doing with all of the Edinburgh festivals. So thank you, and then we'll have a little short time for a question.
I'm very glad you ended with David Attenborough there, because it takes us quite nicely into culture, which is what I'm here to talk about today. Edinburgh is a world-leading festival city. It's a city unique in the scale and variety of its cultural offering. Rare in the world can you start your day with breakfast Shakespeare, then spend the morning exploring public art commissions as you walk through the city, spend the afternoon balancing world-famous comedians in world-famous venues like this, with premiering shows happening in hidden and pop-up spaces in the city. Last year I went to a show in a shed. And finally, you can end the day watching international dance, music, and military grandeur on the esplanade of a 12th century castle, itself built on top of a 700 million-year-old volcano. There's barely a month in our calendar where one of the festivals is not taking place, from bringing in each new year with the traditions and celebrations, old and new, with Edinburgh's Hogmanay, to learning about life, the universe, and everything at the Edinburgh International Science Festival. It's at Easter if you want to come back next year. To hearing from Nobel Prize-winning authors at the Edinburgh International Book Festival, to participating in our Jazz and Blues Carnival, you won't be short of some way to be involved. Even today, across the courtyard above us, the Edinburgh International Children's Festival is in its 28th year, showcasing theatre, dance, puppetry, multi-form, multimedia for audiences young and old. Together, Edinburgh's festivals are a huge part of what makes Edinburgh unique, a place I'm excited to work right at the intersection of culture and environmental sustainability. So in case you're kind of new to the city, the festivals date back to 1947, as Europe was beginning a long recovery in the wake of the Second World War. The Edinburgh International Festival was designed to enliven and enrich the cultural life of Europe, to create a flowering of the human spirit. The Edinburgh Festival Fringe began as a response in the same year and quickly grew to become the world's largest arts festival. And the Edinburgh International Film Festival followed suit, then the Royal Edinburgh Military Tattoo, and so on. The rest, they say, is history. Nowadays, Edinburgh's 11 major festivals combined are second only to an Olympic Games in the audiences that they reach. So, culture and sport together again. Born out of a period of war, destruction, changing threats, and new realities, the festivals have always been part of Edinburgh's wider contribution to society, taking on the challenges of the day. And as we know, in the time of climate change, these current challenges are not few or far between. So Edinburgh is a world-leading festival city, but it's also aiming to be a world-leading green festival city. The festivals have been committed to reducing their environmental impact and increasing their positive contributions for many years. And we hope that by working together with local, national, and international partners, we can co-create a more socially, economically, and environmentally sustainable Edinburgh, a sustainable Scotland, and a more sustainable entire international cultural sector. I've been invited to share a variety of the ways in which this is happening already, only a few of which I can mention in the time. So behind the scenes, the festivals are changing how they work to deliver the unique experiences for which they are known, and the opportunities and contributions they can offer. The festivals are committed to equipping those that work in the cultural sector with an understanding of climate change, environmental impacts and actions, and how they can take direct action to mitigate this. I work with a lot of technicians, of artists, of performers, of set designers. They didn't get into culture because they knew a lot about sustainability. And I'm here to explain kind of what carbon emissions are, what is CO2e, what is all this kind of chat. We were a pilot in the City of Edinburgh Council's carbon literacy training pilot project, which we also worked with the NHS, Lloyd's TSB, and Sahelia Women's Group, training those working in lots of different capacities. For me, it was behind the box office, in cafes, and in programming, all about how they can take direct action on climate change. The festivals are also known for looking to reduce their impact from energy, waste, water, and travel. We have festivals managing to divert 100% of their waste from landfill, festivals making all staff uniforms from fair trade and biodegradable materials, and festivals producing their own reusable cups and carabiners. Our festivals are also committed to excelling in their delivery of their content. Both Edinburgh's Hogmanay and the Royal Edinburgh Military Tattoo are certified as having ISO 2012-1, Don't worry, I didn't know what ISO 212.1 was either. It's a massive collection of letters and numbers. It doesn't mean anything, but it's the Sustainable Event Management Standard. It was initially developed for the London 2012 Olympic Games, and it encourages events organisers to consider everything from animal welfare to HR and living wage. But the role of culture, the arts, and our festivals is always going to be greater than the sum of their composite parts when it comes to sustainable development, to issues of equity, of justice, and, of course, of planetary health. We take the approach that it's not just about what we can do to reduce, what we can remove, and what we can stop doing whilst producing world-class events. It's about what our festivals can uniquely offer in terms of creating arts experiences which drive positive change. Arts events are occasions where people come together to share experiences, to explore different worlds and realities, and to have their lives reflected back at them. When festival shows directly address environmental concerns, they bring these issues to the surface. There are shows from festivals editions in the past with themes of nature, of sustainability, of climate change, and of our environment. For example, last year, the Edinburgh Art Festival, their theme was Making the Future Now. It was hinged around the sustainable city pioneer Patrick Geddes. He coined the term Think Local, Act Global. He was based in Edinburgh. He did a whole renovation of the old town before moving on to places like Delhi. One of their major commissions was of a PHAM house by local artist Bobby Niven. It was placed in the Patrick Geddes Garden in the Old Town, which is Scotland's smallest wildlife reserve. It used to be closed to the public apart from 4 days in the year. Now it's a space that is much more accessible for people to enjoy, getting out into green spaces. Last year also, the Scottish International Storytelling Festival hosted a whole day of professional development for their global gathering for storytellers around the world. Its theme was storytelling for nature. Of course, as you might expect, there are many, 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 many examples of programming around climate change and sustainability at the Edinburgh International Science Festival. About a sixth of their programming is explicitly around sustainability each year. And if you want to see an immediate example of just rushing off so enthused by this, there's a show called Lou at the Edinburgh International Children's Festival today and tomorrow, and it explores the changes and increasing unpredictability of wind, particularly desertification, moving sand dunes, drying up wetlands and jungles, leaving ships buried in sandy oceans, and the biodiversity implications of that. It's aimed at 2 to 5-year-olds. It's non-verbal, but I promise you it's fantastic. So above all, we know that the Edinburgh Festivals cannot lead the change to a sustainable Edinburgh, Scotland, and world alone. International collaboration that recognises the value of cross-border and intergenerational equity, the flowering of the human spirit. That is what inspires us to continue on our work and in our ambitions. So kind of in conclusion, and if no one said this to you already, on behalf of the festivals, I welcome you to Edinburgh, our world-leading green festival city.
So you had a sweeping taste of Scotland there, of what Scotland as a nation is doing. And I think the themes that came through are around connecting with everyone and engaging all communities, whatever age, to be part of a Scotland that is healthier and greener. It's part of the Scottish Government's mission. And also, speaking of festivals, there's an amazing festival called, or exhibition called Hidden Doors, and we'll get the information about that and put it up as well. It's down in Leith at the minute, and it would provide you with, again, another extraordinary insight into the environmental sustainability in our city. I'm conscious we started a little bit late and time's going. Does anybody have 1 or 2 short questions before we... Jonathan's telling me we definitely have a question, so go ahead.
Yes, just a quick comment to Sharon that in the United States, the opioid epidemic, as of last week, has been documented to be expanded to shellfish, so careful what you eat. My question is for Roger. I went with Harriet and Allie and the Chancellery here on this beautiful hike along the John Muir Trail. And I took pictures of the golf courses, beautiful, natural golf courses, which we don't have in my country, the United States. We build golf courses in the desert, in Arizona, in California, golf courses with the fertilizer and the amount of water are very environmentally unfriendly. And I'm wondering, because you have incredibly natural, golf here is fantastic. Is there a document or something about, or protocols on sustainable golf as you take it to other countries? Like don't build golf courses in a desert, or is there some sort of guidelines for doing golf the right way when you're not in Scotland?
Yeah, thank you for that question, and that's a question which we get asked a lot, and of course it's not my greatest area of expertise, but the organisations such as the RNA who have provided the claret jug here, and the USGA, is to make golf much more sustainable. And if you go to the Open this year, the bottles are all refillable, and there's talk, and in terms of chemicals and water, it's high up the priority list to minimise. And obviously, in the States, where there are lots of courses which rely on it, it's not going to be eliminated. But we're hoping that we'll be able to have a much better sustainability footprint than in the future.
I think the opportunity of an event like this is to bring together strategies and to bring together thinking. So the World Health Organization's efforts on global physical activity, the Scottish Government are also coming up with a national action plan soon. But that's exactly the sort of thing that the World Golf Foundation, the RNA, are looking at and working at. If the problems do exist, and they do exist, in terms of participation, female participation, wider inclusion, sustainability considerations, then can we recognise and can we actually affect concrete actions that lead to lasting change and improvement? So you've identified a really important issue. As Roger was saying, from the World Golf Foundation's perspective and from the RNA's perspective, they're really serious about it. And looking at things more widely from a Scottish Government or other type perspective, then I think the opportunities are now, because if there is a problem, then there are undoubtedly solutions to be had as well.
Great, and I think this is something that we can do here as a conference, is petition the World Golf Foundation, saying that you have started some extraordinary work, and we do actually have sustainability of golf programs running in Scotland. How can we share that? How can we encourage you as a foundation to actually be transformative with the reach that you have? And you did mention, I don't know whether people know, that the Scottish golf courses, many of them are wonderfully wild. They actually, nature is there. It's not like these things are carved up. Is that another question at this side?
Hi, I'm Amanda McKinney. I'm from the Institute for Human and Planetary Health in Nebraska. I'm a board member for the American College of Lifestyle Medicine, and I know there is a British Society of Lifestyle Medicine. In lifestyle medicine, we use nutrition, physical activity, stress management, and alcohol moderation and tobacco cessation, not just to prevent disease, but also to treat and reverse chronic disease. And I was just wondering if the British Society of Lifestyle Medicine is very active here, or if you were aware of it.
Another great point. So the British Society of Lifestyle Medicine is active, and one of its board members is based just 20 miles from here. But I think it's fantastic to think not only how we can actually treat problems as they occur, but how can we get ahead of the curve? How can we recognise that a lack of clot-busting drugs and rescue helicopters, as my dad would say, are not the root cause of health issues in Scotland or further afield? How can we make sure that everything that we can in relation to increasing physical activity, working at how we can eat things that are healthy and also sustainable, how we can work at how we can moderate alcohol use and decrease tobacco use, they're the sort of big shows in town. They're the things that can make the biggest difference. So it's great to hear that not only do we have a strong base locally, but I think in America and in other parts of the world. Because if you look at the global burden of disease studies in the Lancet, and if you look at the causes of unfractionated mortality worldwide, they're all these things. It's high blood pressure, it's physical inactivity, it's tobacco, it's alcohol, it's eating the wrong sort of things, and we can together make a really big impact on these.
And there is an international board certification, so if you're interested in that, come talk to me.
That's great. That's great. Well, listen, I'm going to bring this session to a close. Roger, do you want to just make a comment about the jug?
Yeah, just to say that those that came a little late, we have the claret jug here. The RNA very kindly lent us that today. This jug is given to the winner of the Open, which is one of the most important majors in the year. I had a whole list of things I had to say about it, but one of the main thing is don't touch it. So please stand by it, and even if you're not impressed, impress your friends, impress your golfing friends. Thank you.
So, and if you're getting your photograph, what you should be doing is standing by and then tweeting out a message saying, we're encouraging all golfers to make a pledge. I'm going to thank this panel very much for giving us this taster of what across Scotland we're doing to try and consider the changes that need to be brought for a more healthy planet. Thank you to each of you. Thank you, Katrina, Sharon, Mel, Roger, and Andy for giving us these insights. And they'll be around for a little while.